It is my great pleasure to introduce my dear friend, Julie Riley, for an amazing lecture. And what we'll do, Julie, is you talk for as long as you want, and then we'll do some Q&A if you got time, okay?
Yep. Well, I always hate being on Zoom, really. I much prefer to be in person, so I'm sorry I can't really be there, but not very practical for any of us. But I am super excited to do this, and I was so happy whenever Dr. Eisner asked me to do this because it's one of my favorite things to do is to try to help people navigate a very complicated process that I don't know, probably doesn't need to be this complicated, but here we are. I welcome any questions. So if you guys want to interrupt, just grab my attention, say something, and happy to kind of explain it again or answer any questions that come up. You do not have to wait until the end. But okay, so let's get started here. So I'm going to just be very honest that these are opinions and not evidence-based medicine. So you guys are all getting lectures in medical school, but like, this is really my opinion. As Dr. Eisner mentioned, I am a former program director, was so for about 3.5 years, but I have been involved in resident selection for my whole career at 3 different centers. So I've seen lots of different ways that things are done and a lot of different, sort of ideas about how we look at things. But most importantly, I do not have all of the answers, and what I do today will not guarantee that you match into residency. That is not something I can really guarantee, but we'll see if we can help you get through this process. So really, as we think about this, what is the most important question as you're looking at different way rotations and how you look at this in urology? And it's essentially, what will get me to match into urology? And I'm here to tell you, it is not having every single answer in urology and knowing every single thing in urology and being the best technical person. It's truly, what are the faculty and residents saying about you, and do they think that you're a good person, going to be a good colleague as we go through it? So hopefully I can give you some little pearls that you can get through this. Dr. Eisner kind of went through this already, so he's spoiled it a little bit, but I will say I really was not a stellar candidate coming into urology. I had a lot of people that told me I probably shouldn't be a urologist, or at least I wasn't going to make it in through the match. And so it was super important that I did very well on my away rotations and that I was very smart and strategic about what programs I looked at. I was fortunate enough to be a resident at the University of Missouri, where I'm now back and employed. This was my first choice, so I managed to actually do okay. I will always say I sort of fooled them, and they thought that I was a really good candidate, and they matched me. I don't know if I was their first choice, but I choose to believe that I was. So there you go. I got my fellowship at University of Pittsburgh in endourology, and this was also my first choice. So again, being very strategic about how we went through things. As Dr. Eisner mentioned, I was at the University of New Mexico for a long time, almost 15 years, and had such a great experience there, but really loved getting to work with residents and doing a lot of administrative tasks there. I then was a program director at University of Arkansas for about 4 years, so very involved in selecting resident candidates and looking at medical students and mentoring and guiding them through this process, and really a total rebuild of that program, and very proud of where they are now. And I was fortunate enough to come back to the University of Missouri, where I'm still very involved in resident training. And now I get to do it from a very different perspective of having been a program director, so I can like tell you all the secrets or something. But really, truly, after about 20 years of doing this, looking at 3 different programs, I've looked at a lot of applications, I've mentored a lot of students. I've seen a lot of people match. Unfortunately, I've seen some people not match. Some of that is deserved, some of it's not. It's quite a fickle process to go through this, so you have to be very strategic. And so as you think about this, what is like, why is this so important? Like, why are we harping on this? What do we talk about in urology, and why is it so big for us? As a program, we're looking at it as a 30-day job interview. So when you come in to be a student at our program, this is 30 days where I get to see what is going on. And I get to see you when maybe you're not so polished or put together. right? On moments whenever you're not having the best time of your life. Whereas, like in an interview process, you have about 20 minutes, you have to hold it together. You can probably do that. But for 30 days, we're probably going to see you under stress, under fatigue. I want to see how coachable are you. I don't need to see that you are the smartest student that has ever come across. I mean, that's nice, but that's not really what I'm looking for. I want to see, can I actually coach you? Can I mentor you? Are you willing to take that feedback? I really think that this is important. And the longer I've gone in this, the more I think that this is true. Do you understand what urology really is and what urology residency is? This is a really hard it's a really hard specialty because we have such a wide range of things that we do. It's very demanding. I personally think that urology residents are some of the best residents in the hospital. That might be biased, but I'm not sure. I really do think they're very, very good. And if you don't really understand that or fit into that, that's going to be very challenging for 5 years as I work with you. So I think it's important that I can see, do you have that work ethic? Do you understand that process? I want to see how well do you interact with others. So essentially, this is like, what are we looking for, right? Like, what is the program really looking for? Are you going to be a team member? Essentially, I don't want to see, am I going to have a problem for 5 years? Am I always going to have to be harping on somebody to, get their work done, show up on time, be professional, things like that. So it's really, can you handle this job? But please remember the reverse is true, that this is not just about like you're really desperate and trying to get into a residency program. I mean, don't get me wrong, in that position, you are pretty desperate trying to get in, but it is important that you remember that this is 30 days for you to understand the program. So this is your ability to show that you are more than just pieces of paper, right? When I read an application, I'm just looking at an application and it just says, you did this, you did that, here's your grades. But this is the ability to tell us a lot more, right? I have found students that, some of their hobbies and their interests are really quite interesting, and like they make it more than just simply you do good in school and you take tests well. This is a great place for you to get letters of recommendation. Some of the programs that you're going to go to, you're going to meet people that are very well known in the field of urology, very influential people, and so you may want to get letters of recommendation from them, and so it can actually bolster your application as well. Certainly, the big part is you're going to learn more about urology. You're going to see how people do urology in different places and have different priorities, different techniques, different training to get to the same solution. You can understand the culture of a program, because if you're ultimately going to match there and you're going to spend 5 years and essentially the rest of your career looking back at how you trained and how you learned, it's really important you understand the culture of a program. So, is this something that you're going to be able to do? Is your family going to be able to fit into this environment? Can you really work this for the next 5 years? And the flip side is true too. You get to see the program whenever it's maybe not so polished. It's really hard for us to hide any skeletons for 30 days, right? So you're probably going to see whenever, the faculty are maybe having a bad day, or maybe some of the hospital politics that affect the division of the Department of Urology and how that works. So it's a really great opportunity for you to understand what's happening. So essentially, this is like, what do you get out of this rotation? And it is really important that you see that. It's not just a time to just be desperate and hope that they say yes to you. But you can also really develop, what do you want in a program? Do you want a big program? Do you want a small program? Are you wanting something that's a little bit more research heavy? Are you wanting something that's a little bit more community based? Do you want somebody that's, a little bit more independent, or are you wanting something that's a little bit more structured? There's a lot of different ways that you can look at that. And then there's the opportunity to do research, particularly if you don't have some opportunities at home, or you're a little late coming into urology, that this might be a good place to get some research or be able to network. I've just given you a whole bunch of opinions about stuff, but there is actually some data out there. So I think it is worthwhile to actually look at this. And I think we have to put this all in context, that urology match is hard. It's very competitive. This is a 70 to 75% match rate in the last few years. But this is also a little bit skewed because this is not all comers, right? We talk to students beforehand and say, maybe you shouldn't go into urology. Maybe you're not going to be successful at this. So it's, we already do kind of self-select some of these, and some of the students self-select. They realize they're not going to be candidates for urology. 56% of the spots are filled by visiting students or home students in urology. So we know home programs and visiting students are really important, and 38% are visiting students. So these away rotations are probably going to determine where you're going to match. This was a study that came out where the Society of Academic Urologists were looking at what was the most important thing that program directors looked at, and they kind of averaged it overall, and their sub-I performance was significantly more important than anything else. It was the number one thing that program directors were looking at overall. So that the next thing was letters of recommendation, which again, you might be getting on your sub-I, on your away rotation. So here we are. Signals are super important, right? So if you tell a program you're interested in them, they are going to be a little bit more interested in you. And certainly whenever you do an away rotation, that tells us a very, very obvious interest in the program. And you can see the other things that aren't as important, like research, class rank, your step 2 scores, right? Your sub-I performance actually is by far and away more weighted than that. So it is really important we do this. So how do I actually really get good at what we're going to do, since it's so important that we do well and we demonstrate what's going on? And I want everybody in the room to stop and think about a great resident or a faculty member. If it is Dr. Eisner, you could tell him that, but don't. Sometimes that gets his ego going, so maybe don't. But the reality is, right, think about a great resident or think about a great faculty member that you have seen in medical school, or even a history of going to a doctor who was really influential on you, and you said, gosh, that is a great doctor. And I want you to think about that in your brain. And then I want you to say, what qualities did they actually have that made them such a good doctor, so good at what they did? And the reality is that's what you want to demonstrate to us on your away rotation. Show us that. Now, you might be a little bit opposite. Like, I am somebody who definitely learns from what not to do as opposed to what I should be doing. So I looked at it from the other point of view. When I saw a not so great resident or not so great faculty member, or I had an interaction in the healthcare field that maybe wasn't so good, what made them not so good? And the simple truth of how you're going to be really, really good on your away rotation is do more good behaviors and less bad behaviors, right? We all have our weaknesses. We all have our problems, but try to limit those. Try to actually work on improving them and do more of the good behaviors. And it's really not to impress us. Like, don't come in and tell us all of, like, you've read all of Campbell's and you know everything about urology. But what we really want to see is, are you going to actually work hard whenever life is hard, right? Are you going to be the person we want to work with when it's hard, when you're stressed, when you're tired? Do you have those good qualities where you have grit, you have determination, that you're going to be empathetic even whenever it's very stressful? That's the type of behavior we want to see. It's truly that simple. So I do think if you're going to go on an away rotation, it's important you do some research beforehand. Do not just walk into the program and be like, oh, here I am. What do you know? You want to make sure that you choose some programs that fit. This is a great time to be very strategic. Find a mentor in urology that you really respect and that, really is looking out for you, and talk to them about what are maybe some programs that fit, where are places that I should look at. It's okay to reach a little bit, but, if your step 2 score isn't that great, maybe you're not going to be going to Johns Hopkins or Vanderbilt, right? But if you have stellar scores and you like the environment of the research that's done at Vanderbilt, go for it. Try it. Like, that's a great program to go to. But if that doesn't fit you, you don't like research, you don't like certain people that are there, you don't like Tennessee, maybe don't go to Vanderbilt, right? So you have to choose programs that might fit you. Look at their websites, their social media pages. What are they highlighting, right? That gives you a really good flavor of what their culture is like. What do they value in that program? If all they do is look at, research presentations, that's going to be very valuable to them. But if they're posting about, the residents' family members, that's going to be something that tells you what is important to that program. And then talk to people around, talk to former students that were at your program, talk to your attendings, because they're going to know people in urology. We're very small, we know each other, and we can help with that. Before you go to the program, know your faculty that you're going to go and meet. What are their subspecialties? Who are people that you might connect with? If somebody from your home program knows somebody really, really well at that program you're going to, make sure that they have that connection, that they reach out to help you with that. And then you want to find out, who should I get letters of recommendation from? If you're coming into a program, if you are going to go and rotate at Tulane, now you guys don't have to worry about that, but right, if you're rotating at Tulane, I would expect you to get a letter from Dr. Eisner. That would be, somebody who most people in the field of urology know. So we can also help you with that if you ask your faculty, who should I reach out to? And then once you're there, I'm going to tell you some really simple things that you're going to be like, this is it. This is really all we have. But you'd be amazed at really, sometimes we just forget the really basic things. So be present, show up, be early, stay late, be there and be on everybody's mind. This is your 30-day job interview. Read. Why do we want to see that you read and that you come prepared? Well, because you have insight and curiosity. Those are really great traits that we would like to see as faculty members. Offer to help. Don't wait to be asked. Why do we want to see this? Because it shows us that you're proactive and that you have some emotional intelligence to understand that people need help, and you recognize whenever somebody's struggling. Know your patients and own them. This shows us accountability, responsibility. These are great traits to have as a resident. Get one-on-one with your key attendings, and clinic is a great place for this. Do not just go into the operating room and just watch the really awesome surgeries. Go into clinic, because that's where you can really talk to the faculty members. And then be an adult learner. This shows us that you're moving away from kind of the hierarchy and the formality of school and moving into, I want to learn these things and I'm going to be engaged and part of the process of learning, because that is really what residency is about. So I think those are really key things. And then in the OR, whenever you're there, know the basic steps, know your indications for surgery, know the common complications. I ask students this all the time. Hey, what do you think could go wrong right here? What are we worried about? Position, move the patient, introduce yourself, not just to the residents and the faculty who probably know you by now, but introduce yourself to the staff, to the nurses, to the techs, to the anesthesiologists, so they know what you're there for. Ask questions, be engaged, do some small things like close incisions, hold cameras, insert scopes. But I want you to keep in mind that no one expects technical expertise in the operating room. So we don't expect that you can do the greatest cystoscopy and ureteroscopy that has ever happened, but we want to see that you're prepared, you're proactive, that you're coachable, and that as we walk you through those steps of surgery, that you really actually are very engaged in that learning. And clinic. So I will say that this is a terrible picture of my clinic. We share with Ortho Trauma, and they dress up a skeleton, and I love Shark Week, so they dress it up as Shark Week. I don't know, I'm sorry, but that's our clinic. But it is really important whenever you go to clinic that you know who you're working with and that you read. If you're going to go in, if you're coming to my program and you're coming into my clinic, I would expect you to have read something about kidney stones, right? That would be pretty logical that you would be able to answer some questions about kidney stones. Get a pertinent urologic history. Always ask, are you peeing okay? It doesn't matter what problem they're there for. We probably are going to ask you, hey, are they peeing okay? Make a plan for us. I don't care if you're right. I just want to see that you try and that you're really thinking about it, that you're thinking about the differential diagnosis, not necessarily that you got it right, but that you're trying. Be time conscientious. So you may not want to have a whole discussion of a surgery whenever you don't really know what surgery they're doing or how that faculty member does it. So fine, but ask questions, really know your guidelines. The AUA guidelines are extremely helpful as you're going through clinic to be able to help manage these patients. When you're rounding, your job is to make the second year's life better. That's it, plain and simple. Just help out the second year, make them feel like they can do this job because they're overwhelmed, and that's one of the ways to help them. So you can do that by knowing the patients, understanding what surgery they had, what are their, needs in terms of taking out drains or taking out sutures, things like that. Come in on the weekends and help them. This is your 30-day job interview. So come in, help them. Help on afternoon rounds because they can get pretty overwhelmed, and you can help them to, see those patients, make sure they're doing okay. Have supplies like scissors, gauze, tape, because, the second year doesn't want to run for all of those things. It's important you ask for feedback. Ask for it early and at the end, but do it right. This is not the time to be like, hey, can you give me feedback? And I guarantee that the faculty member is going to go, yeah, you did great. You should read more, right? Because it's not really engaging with them, right? That's just simply asking a question and they're going to kind of go through it. You might have a really good faculty member who does better than that, but most of the time they're going to be pretty generic about it. So instead, ask for it right. Say, hey, I really value your opinion, Dr. So-and-so. It was so great working with you. I'm just wondering, do you have a few things that maybe I should continue to improve upon? Was there anything I did really well that maybe I just need to keep developing and getting through? And I think that that can be very helpful. And then from the resident standpoint, you can be a lot more informal. Like, hey, what do you think I should do better? Like I feel like maybe I wasn't really connecting with that attending, or I didn't really understand that case. Like, how can I do that better? And you have a lot more informal interactions with them. And then make sure you ask for your letters of recommendation early, because we have to write a lot of letters, and it is important that you get these and that you get them well. But help them to help you write that letter. Tell them really what you want in that letter. Like, what do you do that's amazing? So that way they know and they can help you put it, they can sort of help guide that letter. As you go into your rotations of urology, what's really important, that what do you need to know? I think the AUA guidelines, like I said before, these are super important, and you can put them on your phone and you can look them up all the time. The AUA core curriculum, same thing. There are some really good parts of the AUA core curriculum. I will say there's a few things that maybe aren't as, in depth, but it's a great place to kind of read and start. Weeders is pretty good. All of the residents will probably have them. I will say there are some not great sections of Weeders, but it's a good place for you to start and have reference. Campbell's is certainly going to have really in-depth and probably too much for you to read during that time period. And your residents are great resources too. Remember, your second year, the first and second year residents are going to be much closer to where you are. And so they're going to really be able to help you figure it out and navigate. And you can ask kind of the dumb questions, so to speak, to the first and second years, because they're going to help you. Your chief residents are going to be a little bit more formal. So you have to be a little bit careful because they might be in the judging process. They might be involved in choosing the residents. They're going to be a little bit, further removed from things. So you want to make sure that you still treat them very respectfully, and, really appreciate the time that they're putting into. So you might want to be just a little bit more formal with the chief residents. I've seen some students who are a little too chummy with senior residents, and it kind of burns them in the end. But your junior residents, those are great resources. After you finish your rotation and you leave, make sure you make contact with the programs. Remember, we're under a lot of strict regulations about how much interaction we can have with candidates, and some programs get pretty nervous about interaction with them afterwards. So make contact, tell them what you thought. Be honest about what it is. Like, if they were your first choice and you really liked them, tell them. If they are not your first choice, do not tell them they are your first choice. That's lying. That's unprofessional. Don't do that. You will get caught in that because we have enough contacts that it will kind of come out. So be honest in your feedback, but do let them know what you liked, what maybe they could improve upon if they ask you that. Be honest about it. Okay, so really, let's get down to the nitty gritty. Like, how do we actually evaluate you, right? Like, at the end of the day, I said it's not the smartest person that we really care about. I don't care if you can recite to me every single, urologic tidbit. I mean, that's fascinating. And I am really impressed by that because I certainly can't do it. But at the same time, that's not exactly what I'm looking for. I want to know, can I trust you? Are you professional? Because I do not want to deal with somebody that's not professional in the healthcare field. Like, that's really hard. Do they overall make the team better? Do the residents want to work with them? Are you coachable? Are you dependable? And most importantly, do I want you as a future colleague? Like, do I want you in urology? So those are the things that you really want to impress upon the faculty members. It's not so much, do you know every tidbit of urology? Can you do the best one-handed knot tying? It's more, are you always professional? Do you have good emotional intelligence? And I think the things that really hurt students whenever they come on to our services and they do very poorly, they're unprofessional, right? They don't treat the janitor like they do, their attending, right? The janitor is doing a really important job. So say hello to them, be nice to them, open the door for them if they're like pushing a cart through, right? Like, be a genuinely nice human being. Don't wait to be told what to do. Be proactive. Try to do things. Do not act like you know more than you know, and definitely don't show up your second year residents or your interns. That doesn't really make you a very good team member. So that's tough. I don't really want to hear that you had to wake up really early or that you had to be here a lot of hours. So do I. That's what residency is like. So I don't want to hear about that. I certainly don't like whenever students come onto our rotations and they only want to talk to the big names of the faculty members and they kind of ignore some of the more junior faculty members, people that have a lot to offer. And if I give you feedback, I don't want to hear a lot of excuses about it. I don't want to have a lot of defensiveness towards that because throughout residency, it is an entirety of 5 years of giving feedback and trying to help coach and correct and improve. And if the entire time I hear a lot of excuses, that's really hard to work with. So take the feedback, appreciate it, and then, do with it as you need to. So really the bottom line is just be the person that other people want to work with. And then once you leave, right? So this is like, these are some of my, residents, some of my faculty members that I work with. So this is sort of our team. So what happens after you leave? What do we do? Well, the program director is going to say, hey, what does everybody think about this person? Like, how'd they do? What you want people to say is, wow, that student was great. I hope they come here, right? The program coordinator says, they answered all my emails timely. Please remember that if you do not respond to a program coordinator, that is a bad sign, right? You want the program coordinator to sort of give a jab at the residents of like, I wish all the residents were so responsive because this is a problem throughout all of residency. You want, these sorts of comments to come up, right? They knew my patients, clinic was better. I gave feedback and they improved it right away. I want to work with this person for the next 5 years. That's what you want the faculty to say. Notice that nowhere in there did anybody say, oh my gosh, they knew everything about urology. Oh my gosh, they could handle a scope better than anybody else, right? These are the things that we really, really stand out and can really help. I'm going to highlight just a couple of special situations in case if people end up in this, because you might end up being a little bit weaker in the academic field. It is really important that if you have a grade that maybe wasn't so good, maybe you struggled on step 2, be upfront about this. Just call it out, right? We will forgive a weakness, but we do not forgive a lack of insight. So if you do not understand that that is a problem and that we will judge you for that, that's problematic. Tell us what happened, right? Don't make excuses about it, but tell us what happened. What are you doing to actually improve this? We will overlook some of these weaknesses if we understand that you're working hard, you're trying to. It turns out every single one of us has a weakness, and every single one of us went through the residency process, medical school, residency, and we were not perfect, and we were not the whole time saying, oh, I'm sure I'm going to make it and everything will be great, right? So we understand this and we'll help you. But do have an amazing work ethic. It's hard for us to overcome somebody who just doesn't want to work, who doesn't want to be there, doesn't want to put in the time and effort to improve upon where they need to improve. it's really important you read, right? Because what we're actually worried about when somebody has an academic weakness, they weren't that great in a grade, or they aren't in the top, quartile or third of their class, we want to know, are they going to pass their boards? Are we going to always be worried that they just don't have enough knowledge to get through this? So if you read and you demonstrate to us, actually, you do know these things, that's really helpful. So this might be a place where I would like you to show me how much urologic knowledge you have, right? Because if I'm going to take a quote chance on you or take a risk on you to match, I want to make sure that it's worth it. And so you're going to prove that to me by other ways. And so you're going to show that you're more than just grades and numbers on an application. You're a really good doctor, right? Like you're a really good person. You have good emotional intelligence. You take care of patients. You take care of things. What if you have research weakness, right? So you didn't really have that much. Again, please be upfront about this and don't make excuses. Show scholarly curiosity, though, and read the literature. Show us that you actually know that. And then show us that you're capable of it. So maybe volunteer to do a little bit on your away rotations. I'm going to put this up here because it's a lot of stuff. But right, I think you want to move to the column where we're excited about. Right, so you're proactive. You anticipate things. You're engaged. You ask thoughtful questions. You stay late. That's really where we want to be. Right? So my final thoughts in all of this is really kind of the sum of all this, right? I didn't really talk a lot about leadership qualities, but so much of what was in here is really demonstrating leadership. You do not need to be in charge to demonstrate leadership qualities. It is really supporting those around you, being coachable, being authentic, really engaged in the situation that you're in, and that can really help. So, and I think anytime that you can look at it from the PD's perspective about how do I choose this person, that's one of the best ways to get there. So finally, that's all I have. This is like the one picture I could find of Dr. Eisner and myself. I've known him for quite some time. This was us actually in Mexico getting to operate, so that was pretty fun. But I am open to any questions, and I will happily stick around for whatever you guys have. I hope you found this interesting, but please, whatever questions you might have.
When was that, Dr. Eisner? Hang on, that's part of the next part. Julie, can you hear me or no?
Yes, I can hear you.
All right. So first of all, amazing. Thank you. That was awesome, and so much sort of overlap there and kind of how I view things. Before we do the Q&A, I thought maybe to spice things up on what's tonight, a Wednesday night. You guys ever hear of the game Two Truths and a Lie? So unfortunately, Julie blew it. So I'm going to give you 3 things. You got to tell me which of the truths and which is a lie. Okay. So the first thing is Julie and I did live surgery together in Mexico, where this may or may not be a picture of, and we talked about the lecture in Spanish while we were mic'd up. I was in Merida, I think, at SMU. So that's the first one. The second one is Julie Riley is an ultra marathoner and has run further than 70 miles in one day before. And the third is Julie and I met at the AUA in 2013. What do you think is the lie? Yeah. So Julie is one of my sort of sports and physical heroes, because for one sec, let me digress. Give us a sense for what the last time I texted you because you were running a race. What was the race?
I think the last race that we texted about, I was in Ironman Arizona. I think.
It was the last one, whatever the last one you did, but tell them what you did.
Well, that was
The
an
distances,
Ironman.
what are the events? What are the things?
So that is a swim, bike, and run. So the Ironman distance is 2.4 miles swim, 112-mile bike, and a marathon at the end of that. I've done double that distance.
All right, so she's run 50 miles in a day, maybe not 70.
Yeah. And then this weekend, actually, I'm about to leave to go to Detroit, and I'm going to swim 6 miles in a very beautiful lake in Michigan. So yeah, I very much enjoy long distance training throughout all this process. So yeah.
When was that picture? When did we go to SMU together, Julie? When was that picture, do you think? 16, 17?
I was trying to remember this, and I was thinking it was like either 18 or 19.
I'll find it. I'll find it for you. I'll find it. All right, amazing. So, thank you for that lecture. I thought that was awesome, and I'll just make a comment or two myself. You know, I agree with you wholeheartedly, Julie. I think that I try to talk about the concept of fit, and I think that, as you discussed, it's a two-way street, right? When people come rotate with us, like you're interviewing us as much as we're interviewing you, right? And that's a big deal. Um, and one of the things I share, Julie, and I'd love to get your comments on it before we open it up to questions, is what I tell people is I say, there's a lot of phenomenal programs out there, right? For the students of your head, you guys, you'll hear there's a lot of phenomenal programs. Maybe there's 50, maybe there's 75, right? There's not 500, but there's a lot, right? And so what I encourage people to do is think about fit, but I think that everybody has to define fit differently, right? So fit may be that you love rock climbing, and so you want to go to University of New Mexico, where Julie was a surgeon many, many years ago. Fit may be that you want to live near your sister, and they're going to live in Boston, which was some part of the decision making that happened for me. You know what I mean? Not all of it. You know what I mean? Fit may be that you want to go to Sloan Kettering and you want to do 2 years of basic science oncology research, and they have that at UCLA. Again, I'm picking on, random. But I think that the point is you have to figure out fit, but fit is different for every person in the room. And by the way, that doesn't end with residency. That's going to go on through fellowship and job, et cetera, et cetera, et cetera. Do you sort of agree with that, Julie, or do you have any comments on that? Or do you want to take this opportunity in public forum to tell me why you disagree with me?
This might be the first time that has ever happened, but I 100% agree with this. Holy cow. I don't think that's ever happened to us before. But that being said, right, like that is so true because what one person thinks is a really great program may be absolutely awful for you. And one of the things that I always think about in this is, and especially whenever I'm interviewing a candidate to come in who might be the most phenomenal candidate, but it turns out I don't have the resources to see their fullest potential. Right. So you want to think about, I mean, this is how your whole career starts, like what your basis is on. And it's really important that they have the resources to make you flourish. I absolutely love the program at University of Kansas. I think that they are just a phenomenal group of people. When I went there, I was like, holy cow, I could never do this because I can't handle hierarchy, like kind of that. And at that time, I think it's a little bit different now, but there, Dr. Thrasher was in charge and he was a very kind of military person. And I would have just, I just can't handle when somebody tells me things like that and they just say, do this, and there's no reason or like the why behind it. And I would have done terrible there, except it's such a great program and trains people so well, right? So there's nothing wrong with that program. It was just wrong for me. And I am definitely not everybody's cup of tea. Like if they come to me and they, if you don't sort of love doing weird things like kidney transplants, maybe you're not going to really appreciate being around me. So, that's okay because not everybody is going to like each other. Not everybody's going to do it the same way. So fit is so important. And it's not just like, can you guys go out and have a beer together? But is this program going to give me what I need and vice versa?
And again, that's the sort of, I think, the challenge, right, is to figure that out, right? And when you guys go interview, well, if you don't do an AI, you get like a day there, right? If you do an AI, you get a month. The other thing I'll say is, again, so if you take Julie and I, you could argue we both did, if we did the fellowship accredited by the same society. Mine was actually unaccredited because I'm a little old, but we did a fellowship accredited from the same society, and we took academic endourology jobs. But well, I'll never forget when we were in Mexico. Julie and I had been friends for some time, but when we were in Mexico and spent a lot of time together, that first trip we went together, she was telling me about her practice at University of Mexico, and I was talking about my practice in Boston, and they were just very different. They were different patient populations, different demands, different departments, different ways of life, different local cultures, and so all those things play in, and they start playing in, at the residency level as well. And even here, like the choice I made to move here, like it's a very different medical community than it was in Boston. Not bad or good, just different. But those are all things that you sort of have to do your best to take your time and think about, because no one's going to tell you that. And the other thing to remember is that in general, let's see if Julie agrees with me on this one. In general, like people went into academic medicine to work with students, right? Like, it's funny, I was giving someone advice. Actually, I was interviewing someone for a chair position and in a surgical chair position today for Tulane. And I was like, remember, like I'm a very positive person, right? So what you're going to hear is a lot of great stuff from me here, right? I'm an honest person, but I then have a positive personality. So remember, you got to kind of take that with a grain of salt. But the point is, a lot of us who do go into this and who spend time teaching like Julie and I do, like we're enthusiastic about working with medical students. So, just remember, sift through that. I mean, Julie's much more of a realist and straight shooter than I am in some ways. I think in some ways I'm a little bit optimistic, which can sort of burn me sometimes. But I do think that, again, remember, kind of who's talking as well. So do we have any questions from the audience? Yeah, go for it. And I'll just repeat it for Julie.
But there's kind of different levels of entrustment to what you get to help with. And how do you read when people are ready to, like, because you don't want to go in guns blazing. So when you say, I have a small handgun for the power of, helping people, that's a horrible metaphor. But like, yeah, how do you navigate knowing how much to help?
Yeah, I really like that question. I have an answer for it too. So Julie, the question is sort of at the medical student level, like how do you, tell me if I'm saying this right, but how do you sort of draw the line, I think, between being not eager enough, being perfectly the right amount of eager, and being over eager and annoying, right? Is that like a fair interpretation? I mean, I have a take on it too. So go ahead, Julie.
Number one, you're going to get it wrong, right? Like, I think the idea that we're all going to be perfect about this is just, it's just a fallacy. There are going to be some people that, you really have to be very aggressive about and really kind of be in their face. And other people, like if you did that, they would absolutely hate you. So there is a sense of some emotional intelligence to sort of read the room. And in fact, that's actually very beneficial as I'm judging students. So I don't think I have a magic answer to tell you, don't be too eager, don't be, too, in the corner. But what I will say is if you're in an OR with a faculty member who is kind of joking around and asking the staff about like how their weekend was and what's going on, this is somebody who you probably want to be a little bit more outgoing with. But if you're in an OR where it's very quiet, it's very still, the texts seem very on edge, this is probably a room where you're going to want to kind of follow the hierarchy, maybe speak when spoken to, you know, be ready to ask very serious questions, like things about what is actually happening in urology. Whereas, like, if you're in that room where things are a little bit more fun, it's a little bit more, outgoing, there's other stuff going on, can ask about like what's their favorite band or like what are you doing this weekend? You can be a little bit more in that personality side. Same thing goes in clinic. Like if you're in clinic and the faculty member is like running around like a chicken with their head cut off and everybody keeps asking questions, maybe this isn't the moment to ask them all about, how they chose urology. Whereas, you can kind of tell that that person's much more relaxed and ready to go, and you can be a little bit more informal and be a little bit more persistent about that. I don't know, Brian, do you have other thoughts about that?
Well, it's funny because you stole my line, read the room, but no, I think it's a very fair question. I will say I did talk to a student about the following the other day, which I think kind of is quite similar. So I think you have to remember every program is different. And right, so the way I described this, to a student the other day was I said, look, the students are very hands-on right at Tulane, right? I mean, just the way the culture is, right? And that's great. So, like I'll scrub out of the case at the end of the case, and the students will whatever put in the stents with the residents or whatever they'll do. And some of my partners even have the students like lasering, In my old job at Mass General, that just wasn't the culture. And so I think I just think you as a student think of it as like I wouldn't like if you went to Mass General and all of a sudden they didn't let you put the stent in, the reaction isn't, oh my God, why aren't they letting me put the stent in? Like it's more kind of understanding the culture. It doesn't mean they like you any less than we liked you at Tulane. Does that make sense? And so that part is tough. And I think, listen, I'll say something. Ready? Okay. I'm not saying I'm anybody important, but I'm the chair of a department, right? And last week I emailed Dean Ham, that's the dean of the medical school here, and I literally said, do you think I spoke up too loudly in the chair's meeting? Meaning I just asked the, I'm 50 years old, I'm a chair of a department, and I asked basically the same question you did to my boss, right? Because it is hard to read the room, especially if it's your first go around, you know? And so, I think, one option is, you can say something like because often like the residents are a touch point for you. Like if I were rotating at Tulane now, I would say to Nick Odiano, who's like or Jacob Greenberg, who's our administrative chief, be like, hey, look, I know every place is different. Let me know what the expectations are of the medical students. Like I don't want to overstep, but I certainly want to I'm certainly interested in learning and growing, right? And let them say, great, why don't you hang out? Eisner likes you to put in the stent, Castle likes you to close the fascia, Thomas doesn't let you do anything. I mean, I'm just picking arbitrary things, but the point is the residents will give you good guidance, But I do think reading the room is important because I think it is natural to say, well, at this place I did X, but at this place they didn't let me do it. What's wrong with me? And it's not what's wrong with you, it's what's wrong with them, or rather what the culture is. Does that make sense? You think so, Julie?
Yeah, and I think you actually highlighted a point too, where when you might have maybe misstepped, or maybe when you said something and you're like, oh God, that landed wrong, you actually reached out and said, hey, can I get some feedback about this? Like, did I do it wrong? Because that actually helps us. I will tell you, residents go too far and not far enough, and they make mistakes, and then they then don't do anything, and they're back and forth the whole time because that is learning. That is apprenticeship learning, right? And that is exactly what we want to see. But I want to see the resident come back to me and say, you know what, maybe I didn't do it that great. Can you help me do it better the next time? Holy cow, yeah, I want to work with this every day of the week, right? So I think if you do accidentally misstep, or you're kind of like, oh God, that went over really bad. Like I told a joke and nobody laughed and it was terrible. Or like I just bombed it on all those questions, to ask for some feedback in that situation, because it really does show that you're very thoughtful, that you're thinking about how to improve. So, Dr. Eisner's story is fantastic in that.
I think the other thing to think about is like you can always sort of be less professional, but it's hard to kind of get off on the right foot and then be more professional, maybe, or maybe to say it slightly differently. Like as Julie points out, like if you walk into some OR, and I'm in there and I'm like, "Hey, Clifton, what'd you do on your summer vacation?" I want to know about your summer vacation, right? But if the vena cava is bleeding, maybe no, but you get it, you know what I mean? And so, I'll never forget. I was once, let's say maybe I was in my very early 30s. I was a new faculty member and I had a partner that was kind of in his 40s and a little bit of an older, stuffier guy. And, the sub-I or AI that you call him now came in and he walked into the OR and I happened to be talking to my partner and he was said something like, yo, what's up, dog? How's it going? You know what I mean? And like, that just wasn't the right thing to say to that guy. You know what I mean? Right. But if he instead maybe said, hey, Dr. So-and-so, how's it going? And he said, I'd really prefer to be said, what's up, dog? You get what I'm saying? Like, I think, you can read the room and read the person a little bit. And, I do think professionalism is important, but you're right. Every OR has a different tone. You know what I mean? And some of the ORs, you're playing music all day. And some of the ORs, you can hear a pin drop. And so I think a lot of it's reading. Yeah. Like, wait, I think Danny had a question or someone else have a question?
I was gonna ask the same.
Same question. Clifton.
First off, I appreciated like the candid nature of the talk, very to the point. What's like one specific example where like a AI has impressed you, like some specific?
Julie, give us some specific, I'll pin her to more than one. Give us 2 or 3 specific examples of something that an AI did that impressed you.
Well, that has changed throughout the years a little bit. And I will say that now I'm much more impressed whenever people challenge me. When I first started in my career, I did not particularly find that amazing. So I always like whenever a student, whenever I'm asking them questions in the OR, doesn't necessarily get the answers right, but is really actively thinking. And they're like, oh, you know what? That's a really great question. I want to think through what that is. And they really try. They don't just give up and say, well, I don't know the answer to that. Right. And they just try. And then if they can throw a question back at me that I have to actually think about, that's pretty impressive to me. And it can be pretty like, it can be pretty nonsensical, right? In the sense of like, well, how do you think AI could help us laser stones better? I just had a student ask me that, and I was like, well, I don't know. That sounds like a great question. Like, let's talk about that, because number one, it kind of stops me from asking, questions about how cystinuria works or something like that, and really puts me on the spot. And that really challenges me, because this really says that this is somebody who's very curious, who's thinking about things. So that would be one. I just had an AI who was here, who we ended up having like a total emergency type situation where all the residents were busy, and I was on call, and I had to go do this emergency case, and my clinic was going on, and I had to be in like 3 places at one time, and it was not really awesome. And I brought the AI student with me down to clinic, and that person was able to help me run a clinic like a second year resident, and was just, there wasn't a lot of discussion. He was just going and seeing patients and really doing a great job. So I think, again, he read the room. He realized that things were pretty stressful. We needed to see patients and do good patient care. And, he was able to do that really, really quite well, and had enough knowledge. I would say that those are kind of the things that really impress me. The other thing that will always impress me is whenever residents come up to me, like kind of without me prompting. Now, this is not something that you can actually do, but it's just kind of the overall general thing. But when residents come up unprompted and say, man, that guy was really good, will you please pay attention to him? Yeah, yes, I will. Right. That's a really good marker. So I do think impressing the residents and helping them goes a long way.
Julie, if you'd like me to email you a copy of my review article on cystinuria, I'd be happy to do it. Just kidding. I think the other thing is like there's a lot of low-lying fruit, Clifton. Like, for example, I do 2 operations and I write hundreds of operative notes. And like if you were preparing for like my clinic or a day in the OR, if you just looked, like if you asked the residents, like, can I see the operative note on PCNL or your ureteroscopy from last month? Like, even if you took a look at it, because remember, I'm not asking you a chief resident level question, right? I'm asking you the basic stuff like, why would I use a safety wire or something, whatever it is, you know what I mean? And so, and again, a lot of times I think that we're not, like, I don't think it's like such a firing squad in the OR or even in the clinic. Sometimes I'm asking people just to have a conversation, or so I don't have to just like tell them the story, do you know? But I'd say that like, if you think about it, like, let's say a patient had Gleason, a prostate cancer, right? And you were going into a prostate cancer operation, like, I don't think you need to know all of the molecular pathways that we're studying in our lab, but you probably should know like the basic treatments for prostate cancer and why, let's say, this patient may have gotten a radical prostatectomy, or maybe think of things like, why would we consider taking the nodes or not taking nodes? Like very basic stuff, but stuff I wouldn't expect a second-year medical student or even a third year who didn't read about urology to know. But like there are basics of, kind of stuff that I think if you brush up on it a little bit. And look, remember, sometimes you get primed, sometimes you don't. Like sometimes say, okay, you're going to be with Eisner next Friday. You have a week to prepare, right? But like the other day I asked a student a question and they were like, I'm sorry, Dr. Eisner, I was supposed to be at the VA and they just tossed me into this case and I didn't have enough time to read. And I said, no problem, like no judgment. That's not on you. That's on my residents. So, remember, try not to kind of overthink it and just remember, like, just be prepared, be smart, be you guys, Yeah.
How should we go about evaluating programs even before we decide where we want to do our AI? Because I think the worst thing in the world would be to end up somewhere or do your 3 rotations and you don't really drive with any of them.
Great question. Dr. Riley, how do we think about which programs we should do our AIs at, or how do we get guidance on where to do? I mean, I have a very specific answer, but how do we figure that one out, Julie?
I could probably talk for hours about this. The first thing is you kind of have to do a little soul searching for yourself. Who are you? What do you want out of a program? You are probably going to end up at the end of the day close to where you did your training. That's pretty accurate for many people. So if you cannot stand being in a rural environment, please do not come to the University of Missouri, because you might end up actually working in a rural environment and that may not be for you, right? Like if you need to be in New York City, probably don't come have a look at University of Missouri. So you have to do a little soul searching about that. That's number one. Number two, I think you have to be realistic about what kind of student you are. If you did not do, if you are not in the top, quartile of your class and you did not just nail step two, some of the top tier programs are probably not going to be within your reach. So it may not be worth going on that AI rotation for that. I do, however, think that you should go to away rotations that are different than your own program. I'm at a program that's pretty small, very community based, very family oriented. It's very tight knit, and I always recommend to students to go to a little bit bigger program and look at some place that maybe has a little bit more interest in research, maybe a little bit more interest in academic, producing academic urologists. And then, maybe go to a smaller program or a program that is kind of the same size, but maybe prioritizes some different things, or maybe in a different environment with different patient populations. So you can really understand, like, where do I fit? What do I do? And I think, a lot of it is really on you because truthfully, there aren't bad urology programs. So kind of no matter where you go, you're going to get good training. It's just a matter of, is that an environment where you can flourish and you can thrive and be the best person that you can be, as opposed to, going someplace just because it has a name or a person that's there.
Yeah, I like it. I'll say a few things. I mean, I'll say that my personal educational philosophy, and this is just Brian Eisner, just one man's opinion, is if I were going to interview it, I think I interviewed at like 13 or 14 programs back then. It's a long time ago. And if I were going to do it again, I would just say that let's assume I applied to 30 programs and every place gave me an interview, right? But I could only go to 15 for argument's sake, right? I would say, and I think you can choose your AIs the same way too. I would sort of say that like my educational philosophy is I would rather interview at whatever you want to call it, 6A programs, 3A minuses, a B plus, 2Bs, a B minus, and a C. Because even the C's in urology are great, right? That's the point, as opposed to 15A plus programs. You know what I mean? Like, meaning I want to stack the deck a little bit and be, some places they think I'm a really great candidate, and then some places I'm shooting for the moon because everybody's shooting for the moon. You know what I mean? So that's sort of one thing. And I think you can argue the same with AIs, right? You know what I mean? You don't have to, right? But like, to me, like, again, like as opposed to going to 3A plus programs, and obviously your home program, like I might try out different programs kind of in different tiers of what you still find acceptable for you, just because it gives you a different flavor. And you have to remember, sometimes the competitiveness is driven by things you wouldn't even think of. Like, there are some programs in very desirable places to live, like maybe New York City or maybe others. Some great programs in New York City, but there's also some programs that are super tough to get into New York City that don't hold a candle to others, but it's because everyone wants to live in New York or things like that. So, you may want to think about kind of the competitiveness and kind of where you sit on the list. I mean, I think also getting guidance from your mentors is a good thing. I mean, I certainly, I'm definitely invested in this group, and the people who go here certainly know that, I'm happy to meet with anybody and talk to anybody about this stuff. The other way to think about it, and I think Julie hit the nail on the head, is, so I'll give you an example. Like, most places get hundreds of applications, right? And I'll just tell you that, like, most places get double, triple, quadruple the number of just signals than even of the people they interview, right? You know what I mean? And so if you think about, like, I'll just give you like rough numbers. These are ballparks, right? Let's assume we have 5 students applying from Tulane this year, right? And let's assume we had 10 AIs, right? And let's assume we interview 40 people, right? So we know the Tulane students super well, right? We know, right, they're 5 out of 5, or the AIs super well too, 10 out of 10. And then we're selecting the next 25 interviewees from a pool of like 200 people, right? And we only get a day with them. So you're always going to be at your most advantaged if you did well at your home school and your AIs, which probably is not that's not rocket science. Everybody probably understands that, but it really is a huge advantage. And you have to remember, from our perspective too, I'd love to hear Julie's comment on this as a former PD and also someone who's still very involved in education. If you think about like my standpoint, right? And by the way, I'm not like a paternalistic chair. Like, I made it totally democratic here. Like, we all voted. I let the residency directors decide. I'm just another man in the vote. Like, I'm not somebody who's changing the list, At the end of the day, like, if you think about the programs, in some ways there's an incentive for the programs, whether realized or not, to choose the people that are going to be the happiest there or the people that aren't going to leave, right? Because again, I just told you I have this pool of like 150 people that signaled me and another 50 or 100 that didn't, and everybody's in the top of their class, right? So I also pick the people that are going to be happy and that are going to thrive, you know? And so some way you get to convince people of that is by your home rotation and being an AI. So would you agree with that, Julie? I mean, I think even more now, I'll say, I think with the signaling, I just think the number of people that are matching that either were home students, AI, or signaled, you know, is getting close. That's close to 100% of the pool at this point. Does that make sense?
Yeah.
You agree
There's
to it?
very few programs that are going to interview if you don't signal. There's very few programs that will not consider you for a spot if you did an away rotation there, right? So, you know, you got to stack your deck and choose that. There's no question that I do not wish to train somebody who's miserably, you know, unhappy and hates everything about the program. Like that's terrible. When I, you know, was in Arkansas, it's not like Arkansas is how do I say this? It's not like it's a mecca of where people want to go, right? So when I choose a resident, like I'm choosing a medical student to come to do training, I'm like, could this person be like a referring provider to me? Will they stay in the community? Right. I have the same thing here in Missouri. Again, nobody is like banging down the door to come to Columbia, Missouri. By the way, it is actually really, really nice and I really, really like it. But like, you know,
She's trying to
if
steal
you're
Patrick
from
from us.
LA, you're probably not looking at Columbia, Missouri, let's be honest. And when, you know, when I think about somebody that comes here, I'm like, could I offer this person a job when they finish their residency program? That's it. I mean, when I say that like your residency program is kind of your ground for everything, like that may be very well your job and your career from there on out. And these are definitely going to be the people that are going to vouch for you for the rest of your career about, you know, who you are as a urologist. So you know, I think it is really important to let programs know how you're going to fit in and like what about that program is really special to you.
Yeah, I agree. You know, it's interesting, even if you look at our last three chiefs, right? So Caleb was from New York, went back to New York. He was a Tulane medical student, he went back to New York. Graham Bobo's from, I think he's from right outside Jackson, Mississippi. He did his residency here. His wife's an anesthesia resident at Tulane. He's going to West Jeff. And Donish is going to do an endo fellowship in Maryland. And I thought he was going to go to Carolina, but he's going to go to Gulfport. So ironically, two of our last three chiefs, none of whom were born here. Donish is from Atlanta and Bobo's from Mississippi, but you know, and I don't know that when they came here for residency, they intended to stay, but you just think you develop connections. You know what I mean? Like our residents rotated West Jeff. The West Jeff guys were like, hey, Graham, like, would you like a job with us? And it all kind of worked out. So it is true. It's not that you're forced to, right? Like I grew up in Miami. I went to med school in Michigan. I was a resident in Boston and I never intended to stick around in Boston. And then I was going to stick around there forever until I came down here. So you never know kind of what life brings you. I'll make a funny sort of statement. You know, I'll say that, well, first of all, you know, there's a bunch of questions that are like totally illegal to ask on the interview trail, and we do not ask them here, and I will not tolerate that. But they definitely are asked of other people at other places, and you know, I'll just say, or maybe they were when I was interviewing. But so, you know, people weren't supposed to ask you like we weren't supposed to ask anything. We're supposed to ask you if you had a significant other, where your family was, where you were applying. Those are all kind of no kind of questions, you know. So what I found kind of interesting was that my whole life before medical school was on the East Coast. I grew up in South Florida and I was at college in Boston, right? But I went to medical school in Michigan. And so I interviewed on the East Coast. Everybody was like, what's a guy from the Midwest going to do in the East Coast? I'm like, I'm from the East Coast. What are you talking about? And then when I interviewed in the Midwest, people were like, you're an East Coaster. Why are you coming to the Midwest? I'm like, I just spent 4 years in Michigan. So some of it is, you know, again, I don't think people are messing with you and I don't think people are trying to trick you in the interviews, but I think they are trying to get a sense for, you know, will this person again fit in? And it doesn't mean like, by no means am I only taking people from the state of Louisiana. You know, more we're taking people that we think are a great fit, but they can come from anywhere. And even, you know, again, our last group, right? You know, Tivoli's from California. She was a Tulane medical student. Chanto is actually a student of Julie's, right? Wasn't Shanta a student of yours at Arkansas? Yep.
Mhm.
And then
Yep.
Michael is from Detroit, Wayne State, but they all did AIs with us, which again doesn't guarantee anything, but we knew them well and certainly made us confident where we ranked them. Other questions? To answer your question, Clifton, I was looking at my WhatsApp here. I wasn't being rude. My WhatsApp with Julie goes back to 2019, but I think that surgery day. I think this day is before there. I should text Javier and ask him. We're a little older. Any parting words, Julie Riley, or no?
What's that? Any parting words? No, I have nothing else if we have no other questions. Like I'm just super excited I got to come and do this, and like here I am staying late, but this is what gives me a lot of joy is helping students go through this. So I'm here as a resource. I know Dr. Eisner has my contact information, and I would be happy if any of you guys would like that. You want somebody else's opinion or just have a follow-up question, feel free to reach out. I am here.
All right, one more question that you can't see the answer to, Julie. There's a binary outcome here. I want you to raise your hands first if you think Missouri is part of the South. The other option is it part of the Midwest? Raise your hand if you think it's part of the South. Wherever she is, doesn't matter. All right, all these people think like you, Julie, that it's part of the Midwest, but I still think you're part of the South. Thank you, Julie. Good luck in your swim race this weekend. We really appreciate it.
Thank you. And I will say you are not in company that will ever think that Missouri is the South. Like that's the South.
Thanks, Jewel.
All right. Bye.